This is a store that provides low-cost quality generic medicines. It became a collateral in a tug-of-war between state policy and central initiative. But now, in a major intervention, the Karnataka High Court has stepped in, staying the state government's order to shut these centers inside government hospitals. The stay order comes as a kind of a setback to the Karnataka Health Department's directive, which was issued in May 2025, which aimed to close down the centrally run affordable medicine centers operating under the Pradhan Mantri Bharatiya Jan Aushadhi Pariyojana. Reacting to the court's decision, BJP MP Tejasvi Surya took to social media, calling it a major win for the poor. Surya claimed credit for raising the issue in Parliament and initiating legal proceedings against the state's controversial decision. He said, and I'm quoting him here, High Court has now stayed the state government's order directing closure of Jan Aushadhi stores in government hospitals. Big win for poor patients and their families. Now, this is really not about politics. Let me also reiterate, it's about poor people, and let's focus on that. Now, the background to this political legal face-off. Now, in May 2025, the Karnataka Health Department had issued an order suspending approvals of new Jan Aushadhi Kendras within government hospitals. All the 31 pending applications were rejected. The order also aimed at shutting down nearly 200 existing centers inside government hospitals. The state's reasoning? Well, Health Minister Dinesh Gundu Rao said that since government hospitals already provide medicines for free, running a subsidized medicine center on the same premises actually was a violation or contradiction of the policy. The government emphasized that patients should not be directed outside the hospital system for any kind of a medication. Instead, the state instructed hospital authorities to procure generic medicine directly or negotiate special pricing with the Bureau of Pharma PSUs of India, which is BPPI. However, critics, including opposition and civil society groups, argued that the Jan Aushadhi Kendras are not replacement, but they are actually ancillaries. They are supplements, especially when certain medicines are not available in stock or when patients visit government hospitals with prescriptions from outside. The Karnataka High Court's interim stay now blocks the closure move, allowing Jan Aushadhi Kendras in hospital premises to continue until further orders. The political war of words will continue intensifying between BJP. While BJP frames the court's decision as a victory for the poor, the ruling government maintains it is streamlining health delivery by removing external influences within public hospitals. Let's understand what really this means, both for the ruling dispensation in Karnataka and also for the centre, that is the BJP. Satyaprakash, spokesperson for the KPCC, joined us, and also Surabhi Hodigire, who's spokesperson for the BJP in Karnataka. Very warm welcome to both of you. So, Satyaprakash ji, you called it policy violation. You said we are not against the stores which are outside government hospital premises, but inside we do not want to. What is your reaction now with the High Court staying the order?
High Court has not given any order. It is only stay. Second thing is, no Jan Aushadhi Kendras inside the hospitals were closed. The news is far from true. We said that after the expiry of your agreement with us, for example, if your agreement is for 2 years, 3 years, afterwards we will not give. That was the decision taken. For existing centers within the government hospital premises, neither the government nor the health minister said anything about those. They can run smoothly. Second thing was, all those centers outside the hospitals, there was no problem. The court has not said anything regarding the applications pending with the government. That is a policy making is the prerogative of any government. While our government will honor what the High Court has said, if it has stayed, we take it. But on record, I want to tell in front of the national media that no Jan Aushadhi Kendras which were existing were closed by the government. They said after your expiry,
you cancelled 31 pending applications. You said that permission for Jan Aushadhi Kendras which are functioning within government hospitals will be revoked, and 31 pending applications for such new centers will be rejected. This is according to the Health and Family Welfare Department in May, sir. What does that mean? You read it any which way you want to read it, sir. No, I'm talking about what was done in May 2025.
The high, see, I'm telling you, no existing Jan Aushadhi Kendras were closed. I'm telling not even one Jan Aushadhi Kendras within the
I'm very
hospital premises were
surprised.
closed.
Surabhi, come in here,
If any
Surabhi.
hospital premises were closed,
No, sir. Surabhi, please
you have
come
to
in.
give me, okay, ask Surabhi to give me proof that which Jan Aushadhi Kendra in which hospital was
Can
closed.
make.
Yeah.
Sir, but is it true or not that there were 31 pending applications in front of your
Exactly what I
government?
said.
Applications were rejected. Now, there is no
High Court,
argument that
High
you
Court
can
has
make
not
it
given
rejected.
any ruling
Please
on
let
those
me get
pending
2 minutes.
applications.
Please let me get
Please
my
read
2
the High
minutes.
Court statement.
Please let me get 2 minutes. Please let me get my 2 minutes. The problem here is that Tala Joshi ji has also said this couple of times that anything that has the Prime Minister's reference is something that the government of Karnataka just doesn't want to deal with. Whether it helps with the helps people who are in need for these medicines or not, whether the poor want to access these medicines or not. The fact is of the matter is that Karnataka state government does not like having Prime Minister related schemes or anything related to the Prime Minister around, because there is no policy rationale you can give me over here. The truth of the matter is that these medicines, the Jan Aushadhi Kendras, have specific medication that has been helping people across the country. Karnataka has been in the top 3 consistently in terms of opening Jan Aushadhi Kendras. Yet, when your government came into power, they wanted to find any potential way to make sure that the Prime Minister is not credited for the kind of work that he's been doing. Therefore, you went after the PM Jan Aushadhi Kendra, which is why the BJP in Karnataka has been very strongly opposing, both on ground as well as on the legal front and parliament, that this is an anti-poor, people move. You should not have done this. And then they send an order saying, okay,
Now,
let's take the argument that people should not go outside of the hospital premises. Were there free medications across 300 generic medicines as well as more complex drugs available in the for free or
Wants
in
to come in, Surabhi, wait a minute. Satya, viewers also need to know that this Jan Aushadhi was started by UPA government. I do not know, maybe all of you are very younger, much younger than I am. It was started during UPA and then it was adopted by Prime Minister Narendra Modi. Now, that's neither here nor there. What Surabhi was saying.
see,
First
I
of
will tell
all,
you
you
something about
instructed
generic
doctors,
medicines.
sir, Satya, please, sir. First, you said doctors in government
Oh,
hospitals should not write prescriptions to go outside and get medicine. How is Jan Aushadhi outside? I don't understand. Medicines for thalassemia, even for autoimmune diseases like diabetes, hypertension, every poor people had access to that. Now, go on,
please
Satya.
understand. Please understand what our health minister and minister for higher education said. They said that when medicines are freely available in the hospital, we don't want any prescription to go anywhere. And that includes Jan Aushadhi Kendra also, because Pradhana Mantri's Jan Aushadhi Kendra will not give any medicine for free. And it is not doing a great service. Every Tom, Dick, and Harry knows that generic medicines, there is no excise duty on generic medicines. While on branded medicines, there is excise duty. On generic medicines, there is no excise duty. And since the excise duty is not there, any Tom, Dick, and Harry can sell those generic medicines at that cost. The state government also
Riding
can
on
run
the
such
part of who you
institutions
call
within
Tom,
hospitals.
Dick and Harry, these are poor people. Satya Prakash, first of all, you
I'm
ordered
telling
the
you,
closure of Jan
what I'm
Aushadhi
trying to
Kendra
see,
inside government hospitals. This is on record.
I'm
I
not
did that show
calling,
with you, Satya. I did that show with you.
I'm not
You
calling,
also
I'm not
said,
calling the
you
poor
also
Tom, Dick,
said,
and
let
Harry.
me quote your
I'm saying
health
any Tom, Dick,
department,
and Harry can give the
opening
medicines
Jan
at that
Aushadhi
cost, is what
Kendra
I'm
in
saying.
government hospital premises is against the government policy. For this, the state government has decided to close them and also terminate existing contracts with Jan Aushadhi Kendra cooperating inside government hospital. This is what was said. All I am saying is, sir, these were
What is
how
government policy in government hospitals? What is the government policy on
that
government
you will
hospitals
not
is
go get
the
medicines
policy
from
is
outside.
medicines should be given for free. Medicines should be given
But
for
these
Can
are
free
I
is the
make a
stand of the
90%
point?
Karnataka
subsidized,
government.
Satya Prakash.
You
90%
ask Mr. Modi,
subsidized.
ask,
No?
ask Mr. Modi to give it free. Ask Mr. Modi to give it free like the Karnataka government is giving free to all the people.
Right. But
That is good
Karnataka
service.
government
Yeah.
medicine shop, people say not all medicines may be there. Maybe I need medicine for, let us say, one disease which I do not get there. At least I have an option to go to the other shop, no, Satya? It's about poor
Are
people.
all medicines available in Janaushadhi? Are all medicines available in
Surabhi, come
Janaushadhi?
in here, Surabhi. This is becoming, I'm only talking about how I
Not
should
all
have the
medicines are
option.
available in
You
Janaushadhi
cannot
also,
curtail me.
Sudha.
This inane
Yeah,
argument
please.
is
I will not
devoid
continue.
of any kind
You
of
are the
data. May I
boss.
please come in, sir? May I please come in, sir? Please.
Satya.
Over 30,000 crore has been saved across the country in the last 10 years. We're talking about 2,000 plus generic medicines and 300 items relating to surgical items. Cancer related medicine, thalassemia related medicine. We're talking about medicine that people could not access at 50% to 90% reduced price that you are today taking away. This is the same thing that you're doing with 70 years plus the Ayushman Bharat care that people are supposed to get. You're taking that away merely because it has the Prime Minister's name involved. This is not proper. This is anti-people policy that the Congress government has come up with. And then please let me remind you all, when you mentioned that these 31 pending applications should be rejected, you said negotiate with the pharma vendors, you negotiate with the Bureau of Pharma PSUs of India and get a reduced price. You told your hospitals that come under your department to do that negotiation for all of the medicines that were supposed to be coming through the Jan Aushadhi Kendras. There is no argument that is fact-based or data-based that you can use to defend your government in this case.
See,
Please stop having this hatred
how I
towards
defend
government
my
agencies
government, I
in
will
the
defend
sector.
my government at
Learn
all
to
costs,
work
and I can
together
tell
in
you
a
how.
democracy. Learn federalism works both ways, sir. Please. There is no need to deny
I
people
will
the
tell you.
rightful that they're getting from the central
I will
government.
tell you.
And may I remind you, this
I
same
want to
government
ask a simple question to people
previous
of Karnataka.
months
I will ask.
ensured that Jan Aushadhi Kendras were opened in Karnataka, yet you changed your
I
stance suddenly.
want,
You changed your
I
stance
want to ask.
suddenly. Why?
Give me a
Why? What
chance.
policy?
Surabhi,
What
let me also come in here.
policy?
Surabhi, people like, there are many people, XYZ, who had made investments and paid money to open this. They sat there saying, now what? It's been cancelled. Where do we go? So this is like multiple problems were there. Let Satya Prakash also explain, Surabhi. He was going to say something. Satya Prakash ji, please go ahead.
See, even today, my Surabhi is my good friend. From long time we have been doing shows together. Sudhaji, Jan Aushadhi Kendras outside the hospital you can open. Any amount of Jan Aushadhi Kendras you can open. We are not against Mr. Modi. We are not against anyone. But what we are saying is, within the hospital premises, our policy, government policy is we are going to offer free medicines outside the premises. You give, no problem. Even today, if someone wants from any hospital, if someone wants to purchase Jan Aushadhi medicines with the photo of Mr. Modi, we are not against Modi. But let them purchase outside the hospital, because it is government policy of the Karnataka government that no medicine should be sold within the hospital premises. Even today you can sell outside. Now I want to ask
Yeah,
people of
understood,
Karnataka.
understood. But you know,
In the
yeah,
hospital
but I
premises,
think,
you want medicines
why
for
this is
free
curtailing
or you
someone's
want medicines
rights
at 50%?
to actually have an option. You know, there are sometimes two stores. I mean, I go to a I take someone in my family to a very fancy hospital. I never buy medicines there. I come out and buy medicines. I should have that right where to buy medicines.
No
No,
problem.
I just don't understand. Come
Yeah,
in here, Surabhi.
you
I
can
mean,
buy
you
from a
why?
general
First of
city.
all, you may have a policy. You may have a policy, but then why did you cancel all the pending applications? You know, there is a multiple domino effect of all this. Why take the rights away of a poor Kannadiga or anyone else, sir?
All the pending applications,
Government
all the
hospitals
pending
are for
applications,
poor
you can open
people.
the store
Surabhi,
outside
come
the
in here,
hospital.
Surabhi.
There is a slight, it doesn't add up over here. You don't want poor patients who, want them to have access to proper medication, free medication, subsidized medication within the hospital premises, but you don't want them to go outside. You don't want them to take the prescription outside. Which one is it? Where would you rather that people buy their medication? And what we think is a very, trivial matter, it is an incredibly important matter, sir. I have received calls, spoken to people who have told me multiple times, we were looking for a very, very rare medicine, or very rare disease, or very critical disease. We need these drugs. Where do we go for it? They don't go to your they need these Jan Aushadhi Kendras. So if you're against Jan Aushadhi Kendras within the hospital premises, but for Jan Aushadhi Kendras outside, there must be some rationale. If you're telling me that policy is the rationale, let me remind you, Satya Prakash sir, and the entire Congress, which is hell bent on this Nehruvian model of bureaucratic, the policy is there, so we should follow it. Policy is there to make sure
Let me add, Surabhi, let me add
Policy
that
is
this
there
Jan
to
Aushadhi
make
J case,
Policy is not there to make sure you come.
No, no, the Jan Aushadhi Kendras, Satyaprakash, can I just add the JAKs? Let's, this in the acronym or where. They act independently of district healthcare systems also. So it also helps. If in a district, let's say any district, they do not have the medicine, then you have the option of the JKs. One can go there. But if you are not giving the option at all, I find that to say it's a violation of policy, I find it rather that it is more of a problem with the central dispensation led by Narendra Modi than so many poor people in Karnataka. Satya, go ahead.
See, what I'm telling is, Surabhi, we are not against giving medicines for people for, at 50% cost. We are not against. And that is not any rocket science because I come from pharmaceutical industry during my formative years. The difference between branded and generic item is the excise duty on branded items is different. There is no excise duty on generic items, very less excise duty. That is the difference. What you give in Jan Aushadhi Kendras can be given by the Karnataka government also at 50% cost. But we cannot sell medicines at 50% cost in. Allow me, please allow me. We cannot sell medicines in government hospitals because that is a policy of the Karnataka government to give it free. I give one more example.
What is this center and state fight? This is not the government of some utopian country. This is our government, no?
30 seconds. I will finish in 30 seconds. Same, whatever Mr. Modi is doing through Jan Aushadhi Kendra, if I ask a private party to sell generic medicines within the hospital, even he can sell at 50% cost. It is no rocket science. But as a policy, we want to give medicines free to the patient, but since it is High Court decision, we will oblige. But High Court has not said that you have to give permission for the pending 31. Show me. Where it has given, you show me, you read that judgment, please. It has given stay that on the existing this thing we should not close, and we have not closed any as on date. And
what the Honorable Court has said is that you couldn't have, what it has said is for the benefit of the poor people is what I will take it as an Honorable Court, and it has really gone against what your Health Department and Health Minister did. Now come on, Surabhi, I don't have much time. Come in here.
See, the shop should be open. It has not said give fresh, it has not said, the court has not ordered the state government as per my knowledge.
The argument you're trying to make is going loops and loops without any rationale. I'll tell you why. If you are not against people receiving medicines at the subsidized cost, good. Which is why you are in agreement of the court's order, which is that they have said that do not cancel these policies. They've said that government hospitals require this Jan Aushadhi Kendra. We're all in agreement, right? We're all in agreement that Jan Aushadhi Kendras now have to function in hospitals. So therefore, do not go right
outside.
This is our policies. This was not our policy. Just accept that here is a wonderful scheme that has been working across the country, saved 30,000 crores plus, benefited lakhs and countless people. Our people are in need of this. Therefore, the government of Karnataka now on should support this fantastic initiative.
Well, both of you, why is it that the government hospitals cannot integrate Jan Aushadhi Kendras? Make it one unit.
Policy, policy is just something that's on paper. It's not thought of to be pro people. It's just policy.
That is exactly
policy
what
is
I'm
an excuse to deny people their rights. This is the Congress government in Karnataka which is hiding behind policy and denying people something as simple and basic as
I have 1 minute left, Satya. 1 minute, Satya. 1 minute. Then I'm going to wind up. Yeah.
See, I will be very clear and precise. We are committed to giving free medicines, not 50% medicines like what Modi is giving. If Modi has so much of concern for the poor people in Karnataka, let him give free.
Your government is bankrupt. Your government is bankrupt, says people within your government. So please don't tell me all of these things. You deny people subsidized healthcare from 50 to 90% subsidized healthcare across 2,000 plus medications. You are denying people healthcare access. Your government is bankrupt and actively working against people today.
Any Tom, Dick and Harry can do generic medicines at 50% cost. Tom, Dick and Harry can do generic medicines at 50% cost.
I have to wrap up because any which way, Surabhi and Satya, last 2 minutes I did not even understand what you were saying. And I thought you were both pro-poor. But ultimately it becomes tu meh meh, there is no, but the point is, today the High Court has spoken. Let's wait for further things. Let's see if the Jan Aushadhi Kendras will once again operate inside government hospitals in Karnataka.